Well, when we hear the term tongue-tied, you might think of somebody who feels on the spot, stumbling and stammering for words. But being tongue-tied is a very real condition for 1 out of every 100 children born. It's called ankylosing. And this month marks National Children's Dental Month. And today is the last part of our 4-part Dental Discovery series. And so we're uncovering exactly what this condition is, how it can affect a baby's development, and how it can be treated. Here to give us some help this morning is Dr. Wayne Harrison, the VP of Sales and Marketing for Biolase Technology. Morning again to you, and it's always good to see you.
Very nice to see you.
It's interesting, when you think of tongue-tied, you do think of it as you're not being able to find the right words. You don't think of it as something that affects children. What does it mean to be tongue-tied?
Well, Danielle, we have 7 frenums in our mouth. We have 3 in the top, we have 3 in the bottom, and we have the 1 under the tongue. And to be tongue-tied just means that that attachment of the base of the tongue to the floor of the mouth is just a little bit tight, it's a little bit restrictive. Some people think it's a congenital, possibly genetic disorder. Many times it recedes on its own. Within a year or so after birth, it just takes care of itself. But in some instances, when it's not taken care of, it can affect the baby's ability to breastfeed. It could certainly affect a child's ability for speech development and then ultimately their social development as well.
And so then how would you know if your baby is tongue-tied? Because you mentioned, breastfeeding or feeding and that kind of thing. Or these are just some of the signs to look out for.
Well, obviously with a baby it's pretty hard because you can't ask a baby to stick out their tongue. So certainly if you notice that your baby was having a difficult time breastfeeding, and that's something that you would probably want to, see a lactation nurse or something like that. But for an older child, kind of an at-home test you can do is have the child stick out their tongue, and because of the restriction of the tongue-tied, it will actually form a little heart shape on the tip of the tongue. So that's one of the ways you can tell. Obviously, the other way would be have a child lick jelly off their top lip, and if they can't do that,
they can't get up there,
then they probably have some restrictions.
And so then how is it treated?
Well, traditionally, it was a treatment that I personally didn't like doing in my dental office. It was called Z-plasty, and we had to anesthetize the base of the tongue, and then we used a scalpel to be able to cut those fibers and then place sutures. Today, with a Waterlase technology, we can do that minimally invasively. We do it in a painless biologic way, many times with just a topical anesthetic and then a very quick procedure with the laser.
I love that idea. It's quick, especially for children. Who wants to put their child under? I mean, you definitely don't want to do that. And so then how does the laser work?
Well, obviously, as we've discussed many times before, the laser uses 2 naturally occurring items. It uses light, the laser energy, it uses water, and we use the naturally occurring water that is in the human tissue, and the laser has an affinity for that, and it can very dramatically cut those fibers, and most often no sutures or any other follow-up care is needed. In fact, many times when we treat young babies, they can nurse immediately afterward, and so we know that there's no pain associated with it.
Oh, and speaking of success stories, I know that you and I were talking a little bit off camera, and you've got some really wonderful stories. Can you tell one of them to our audience?
Well, there's so many, and thank you for asking. But Dr. Fred Margolis is a pediatric dentist that uses our Waterlase technology in Illinois, and Fred was sharing a story with me. He has many, many people that drive hundreds of miles to come and see him, but this story was a small baby. The mother was determined to have her baby be able to breastfeed, was unable to do that. They drove 500 miles through the night to get to Illinois for Dr. Margolis to literally do a 2-minute procedure, and the baby was able to nurse immediately. And the father, after the procedure, said, Dr. Margolis, we're so grateful. The trip was worth it. In our hometown, they wanted to put the baby to sleep. Sutures, needles, scalpel, all these other things. And you think about that, a 4-week-old baby, who wants to go through that?
What a terrific story, and I'm certain that's something that a lot of parents out there can relate to. But I have to tell you, Waterlase is something I had not heard of until you started coming on the show. And so how can people find out more information about this wonderful technology?
Well, they can go to waterlasedentistry.com, and on there all of the dentists using our technology are listed by zip code, and they can certainly find a dentist. But one thing I just want to re-emphasize, Danielle, It's not just about being tongue-tied, which we've talked about, or smile design, or or gum disease, it's really important to know that this being Children's Dental Health Month, a child should never ever need a needle in their mouth to have a cavity filled. They should never be afraid of going to the dentist. With Waterlase dentistry, we can do cavities painlessly without anesthetic. More often than not, avoiding all the other side effects of the dental drill. There's no cross-contamination or any other things we've talked about over the course of our segments.
I have to tell you, your segments have been so informative. I've so enjoyed meeting you and talking to you here every month. Hopefully you'll come back for another series of segments with us.
Thank you very much.
Thank you for being here, Wayne. Always good to see you. And we hope that you've enjoyed watching our Dental Discovery series. If you want to find out if your dentist offers Waterlase or how they can, simply go to the website. It's waterlase.com.